powered by Radiance Diagnostics, where we shall discuss about practical ways to live healthier and happier. I am Abbigail, your host for today, and today we shall dive into a topic that is affecting millions worldwide: obesity. Today we shall discuss health risks, effective solutions, and social stigma with our expert guest, Dr. Sujoy Das, consultant laparoscopic and bariatric surgeon. Welcome, Dr. Sujoy.
Hi Abbigail, happy to invited me to share my insights about obesity and the kind of epidemic proportions that we are seeing it spread in the whole of the country as well as in Goa.
Doctor, obesity is often misunderstood. People think it's about eating too much or lacking the willpower. Is that true?
You absolutely hit the right point. There's a lot of what I call it fat shaming and body shaming when a certain individual is pointed out as obese. Yes, the person is obese, but there are multiple factors that contribute to it. One is the patient's lifestyle, the patient or the person. The second is the eating habits. Third is genetic, and fourth is hormonal. All these together plays a part in a patient's obesity.
Perfect. Let's help our viewers understand this from a medical point of view. Okay, so doctor, what is obesity and why does it happen?
Let me explain what is BMI. BMI stands for Body Mass Index, which is an equation where the patient's weight in kgs is divided by the height in square centimeters. So when you get that, you arrive at a particular figure. Now, if it is less than 25, it is considered to be normal. 25 to 30 is considered to be overweight. 30 to 35 is class 1 obesity. 35 to 40 is class 2 obesity, and more than 45 is class 3 obesity or very severe obesity.
What causes obesity?
Okay, it is commonly conceived that it's more calories. It's not as simple as that. Calories matter, but it's not all that matters. It is also genetics, it's hormonal, the patient's metabolism, also his lifestyle, finally if he's unstressed, and also the kind of sleep that he gets.
Okay, right. So doctor, from what you're saying, diet and exercise are not always enough.
Exactly, diet and exercise are not always enough, because you will see two people following the same diet, doing the same type of exercise, but one will be thin and another will be obese, because there are genetic and other hormonal factors that come into play.
What about the types of fat in our body? Do some pose higher risk?
Yes. So we have two types of fat. One is something called subcutaneous fat. Subcutaneous fat is measured by something called triceps fold thickness. This is the kind of fat that is called subcutaneous fat. When you pinch somebody, when you hold that, it's called subcutaneous fat. The second type of fat what we have is called visceral fat. Now visceral fat is the one which is inside the tummy. You have seen people with big tummies. Yeah. So that's when the fat is in the omentum, in our intestines, around the intestine, in the liver, and in the abdomen. That's the worst kind of fat. That visceral fat gives rise to heart disease, heart attacks, your strokes, diabetes, and all the ill health that you get from being obese.
Obesity stigma is real. How does it affect patients?
So firstly, the patients who are obese have always a low self-esteem. They're always on the lookout. They are looking out for people who are passing bad remarks. So they are they're very aware. They are what to wear, how to behave. Even when they feel ashamed to eat something in public. But that's the first thing that obesity affects them. Secondly, they are kind of ridiculed. They're at the butt end of jokes when they're traveling in public transport. So obesity affects a patient mentally. So you should never make fun of a person who is obese. You don't make fun of patients who are diabetics or hypertensive. So why should you make fun of a patient who is obese? The patient is suffering.
How can society as a whole and doctors help in breaking the stigma?
So first thing is what we say when somebody is obese is we say you're having a disease. The moment you say it's having a disease, it's no longer a stigma. Like it's a disease like diabetes, blood pressure, hypertension. You have it. Now you have to deal with it. You have to be brave enough to come to your doctor and ask what can I do about my obesity. There are dieting exercise, one of them. There's also injections. There are also surgery. There are balloons, endoscopy methods. So there are multiple ways we can tackle obesity, depending on how you are.
What about children? Is the stigma affecting them too?
That's a nice question, because if you see in schools today, when you come out of a school break and you see the children coming out of school, you will find young boys and girls, they are so obese. They are, which was not there 15, 20 years back. So what has changed in these last 15-20 years? It's the kind of diet, lifestyle, mobiles, not going to the playgrounds, children watching iPads, movies, televisions on their phones. All this has caused to a huge societal changes where, unfortunately, even the small children are obese.
Many of our viewers must be wondering when should I consult a doctor with regards to obesity?
Exactly. So many people feel awkward to consult a doctor. So let me put you a few points, put forward a few points where a patient feels that he has to consult a doctor. The first thing is when you're obviously physically very obese, your weight scales are more than what your normal weight should be. Say, any Indian should not weigh more than 70 to 80 kgs. Of course, if he's tall, he can weigh 90 kgs also. But anything where your number scales are wrong. Secondly, when you're feeling tired, you're fatigued, and finally, you have to consult a doctor if you're obese and you have diabetes, blood pressure, hypertension, or any other disease that is like you snore at night, you're getting joint pains, you're getting back pains, you're developing black acanthosis nigrans, which is called pigmentation. You get pigmentation at the back, at the pigmentation in the neck. So, and you feel breathless after walking a few steps. So, all this should make you consult a doctor immediately.
What happens at a consultation?
So first thing first, when you come consult a doctor, what I do is I take your height and weight and I plot you on something called a BMI chart. So a BMI chart is nothing which has a height mentioned in centimeters and your weight mentioned, and then I calculate your BMI. Now as I showed you, anything below 25 is considered to be normal. Anything 25 to 30 as per the BMI chart is considered to be overweight. 30 to 35 is class 1, 35 to 40 is class 2 obesity, and class 40 to 50 is class 3 obesity. So first the doctor will grade you. Secondly, the doctor will also do blood tests, do your sugars, do your ultrasound, do your x-rays, examine you, see how obese you are, what are the other things that are lurking behind obesity. Finally, you will be asked to undergo a cardiac evaluation and a respiratory evaluation and a sleep test to see whether you have snoring. Are you snoring at night? Are you sleeping well? Are all your cardiac parameters are echo? Your heart is functioning normally and your lungs are functioning well.
Doctor, let's talk solutions. Starting with lifestyle first.
Yes, so lifestyle modification is the biggest thing that I always recommend to all the people who consult me for obesity. First thing is start walking. Everybody should have a minimum of 10,000 steps a day, and believe me, 10,000 steps is not easy. It's like walking 6 to 7 kilometers, but you do it over the course of a day. Somebody is having a desk job, you sit on the desk, fine. You work for half an hour, walk for 10 minutes. Again, come back to your desk, walk for half an hour, or get up and walk for 5 minutes. Secondly, eating in moderation. Don't eat, the Japanese saying they never eat when you're 100% full, just eat when you're 80%. The moment you're 80% full, get up and stop eating. Don't go for visual eating. When you see something, you feel hungry. If you've eaten a meal, if you're not feeling hungry, please avoid it. Third is the type of eating. Don't go for fried foods, oily foods, sugars, sweets, ice cream, chocolates. These are the calories that are killing our children and our people today, the young adults. Sugars, sweets and carbs are to be totally avoided.
What medications are used?
So coming to medications, there are multiple medications that we can use. Something as diet suppressants or hunger suppressants. Second is medications which increase the metabolism, and finally we have the latest medications, which is in a big, we must have all heard of these injections where people are taking. These act on the intestinal gut hormones and increase a certain hormone which causes the sugar not to be absorbed as well as decreases the hunger. They are called GLP-1 analogues, which act on the receptor as well as on the hormones. So these are big advances come up in medicine, but these only act to decrease your weight by 10%, 5 to 10% of your excess body weight.
What are the types of surgeries available for obese patients?
So again, we have to classify a patient now. There is a whole spectrum of surgeries available for the patients with obesity. You can have endoscopic surgery. If you're mildly obese, you can have a balloon put in the stomach. You can have a endoscopic sleeve done. You can also have an endoscopic bypass done. But these are surgeries which are done in few centers by experienced hands. The second group is called laparoscopic surgeries, where we just cut the stomach, we make it small, or we cut the stomach, make it small, and also bypass a segment of the intestine. So these surgical methods are the ones which are persistent and give a long-term control of your weight. And these are also known to bring down all the comorbidities associated with obesity, like diabetes, hypertension, your joint pains, your everything disappears. Once you lose your weight by 25-30 kgs, your diabetes goes, your blood pressure goes, your everything disappears, because they're all related to obesity.
Doctor, is surgery safe?
Yes, surgery today is very safe, fortunately, due to the intense advance that medicine has made. I have personally done more than 300, 400 bariatric surgeries and not lost a single patient and not a single complication. But that's not because of the surgical techniques, but also because of the modern advances in surgery. Surgery, the camera systems, the drugs that are used, the staplers that are used have contributed hugely to making surgery a very safe option for people who want to have surgery done.
Are there any new advancements?
Yeah, so the new advancements are like you have keyhole surgeries. Now, all these patients who come for bariatric surgery stay for only a day or two in the hospital. Gone are the days where you had a big cut for a surgery and patient was in the hospital for 7 to 8 days. You can have, these are also pain-free surgeries. You don't have hardly any pain. You're walking in the evening, next day you're sipping fluids, third day you're at home, you can do your light work. So surgery has become a lot better and much better what it was, say 10 or 15 years back.
Dr. Sujoy, now let's tackle some questions with short answers.
Yeah.
Doctor, why do some people gain weight even though they eat very little?
Exactly. Now that's what we come to, blessing with good genes. Some people have good genes. Genetically, they have good metabolism. So whatever they eat, they metabolize well. And some people may eat the same amount of food and put on weight. So it's just genetics.
Okay. Does skipping meals help or harm weight loss?
Skipping meals done properly in a proper way helps weight loss. We'll later on come to intermittent fasting. That's where intermittent fasting comes a big way. If you're going to skip meals, skip the evening meals, skip the night meals, because the maximum weight is put on after eating at night and in the evenings.
How much does sleep really affect weight?
That's a good question. Now, most people think sleep has nothing to do with weight, but believe me, if you're going to sleep less than 4 to 5 hours, you will put on weight. So a good rule is at least 7 hours of sleep, and 7 hours of sleep at night, and keep your mobiles away, keep all your tablets and mobiles away, and a good 7 hours of sleep is a must.
Do certain drinks like soda, energy drinks, or even fruit juices contribute to weight gain?
Yes, that's a good question. The moment you enter any supermarket, whatever is kept in the front, it leads to all weight gain. Your biscuits, sweets, ice creams, cakes, pastries, and bread. The moment you go behind the supermarket, you will see all your meats, you will see your fruits, vegetables, your milk, and these don't cause weight. So please avoid whatever is kept in front of supermarkets.
Okay. Are certain foods more fattening than others even if the calories are the same?
Yeah, certain foods are definitely much more fattening. Like, let's put it to carbs. Like, carbs are definitely fattening because carbs straight away become glucose, and glucose accumulates as fat in your body when they're excess amount if you're not running and not using it. So rice is considered to be fattening, but let me also tell you, the Southeast Asian countries like Japan, China, Korea, Vietnam, Thailand, they have rice for breakfast, rice for lunch, and rice for dinner, and they don't put on weight because they just small amounts of rice or noodles along with lot of proteins and vegetables. So you have to have a low carb base and more of proteins and vegetables.
If I only exercise without changing my diet, will I lose weight?
That's a good question. Your diet and exercise go hand in hand. It's not one is complementary and other is free. No, you have to do both. If you do only diet and don't do any exercise, it doesn't work. You will be weak. You'll feel weak. Your muscles will be weak. If you do only exercise and keep eating everything what you want, doesn't work. So both are like complementary. They go together.
What is better in the long run? Cardio or strength training?
Actually, both are required. Just like how diet and exercise goes together, cardio and strength training both help. Cardio is very good for losing weight, for burning glycogen, losing fat, especially when you do a slow jog, a slow run. And weight training is also makes you lose weight because it develops muscle and both go complementary. They are complementary to each other.
Can stress really make you gain weight?
Yes, stress is one of the biggest causes of weight gain. If you are stressed out, you tend to eat. You don't tend to sleep. You don't move around much. So stress is definitely a big factor for causing weight gain.
How does hormonal imbalance lead to obesity?
So hormonal imbalance is one of the factors. Like if you have an hormone, there are multiple hormones in our body called ghrelin, which is a hunger hormone. There is insulin in our body, which is also a hormone which burns sugar. There is glycogen in our body, which makes sugar. So all these hormones are interplay in our body. Now it's if one of the hormones goes higher, that's how you can have more of fat in your body.
What role does genetics play? So, if my parents are obese, am I doomed?
No, you're not doomed as such, but if your parents are obese, you have a high chance of you being obese. So you once you know that your parents are obese, you know that you have a genetic factor going against you. You should immediately get into diet, exercise, modification of lifestyle, and that will take you a long way.
Are children who are overweight more likely to be obese when they are adults?
Yes, children who are overweight at a younger age tend to be not only obese when they're adults, they tend to be early diabetics, early hypertensive. So this has been proven by medical studies that yes, it's a risk factor. Childhood obesity is a big risk factor.
How do screen time and smartphone affect children's weight?
So screen time and smartphones are very obviously you're not moving, you're not walking when you're watching something. You're lying down on the couch or you're on your bed or you're sitting on a chair. You're not moving for hours. Now tell me, it's just plain common sense. The moment you watch so much of screen time, 2 or 3 hours of screen time easily contributes to obesity.
Are weight loss medications safe in the long run?
Any medication has side effects. Let me tell you this. Even if you take a plain paracetamol, if you take in extra doses, it can cause liver failure. Similarly, all medications have side effects, but if you take in a right dose under the supervision of a doctor, they are perfectly safe.
When should surgery be considered?
Surgery is considered when all your diet modification, lifestyle modification, everything else has failed. You have given a good chance at diet, fasting. You have tried for a year and a half and nothing is working. Your weight has not gone down. You have uncontrolled diabetes. You have blood pressure. You're getting joint pains. You're not feeling good. You're feeling lethargic. You're feeling tired. You're feeling weak. You can't climb up 2 floors without getting breathless. That's when I think so. You should have a surgery done.
How does bariatric surgery affect in the long run?
See, bariatric surgery is what? It's a surgery where we make the stomach small or we bypass a part of the intestine. These causes hormonal changes in our body. By one thing is it decreases the amount of food that you can eat. After you had bariatric surgery, you can't simply have a big plate of food. You'll have to have multiple small meals. Secondly, absorption of the food also differs. There are hormone like GLP-1, your ghrelin levels, they all increase in after bariatric surgery. So we feel less hungry. Our sugar is not metabolized as much as before, and that's how these bariatric surgery works in helping weight loss.
Doctor, there is a saying, no pain, no gain. Is surgery an easy way out?
Yes, so you can say that surgery is an easy way out because I get a lot of patients who are obese, and when I tell them, have you done exercise dieting, they say, no, I tried for a month. You have to give it a good go. You have to give surgery. If you want surgery, it's done only when dieting and exercise fails. It is not the first go to come and immediately get operated. Everything else fails. Your dieting fails, your exercise fails, your medications fail. That's when we advise that you should have a bariatric surgery done.
Can obesity be reversed completely or is it a lifelong management?
It is a lifelong management. It is not that there is no magic wand that you have bariatric surgery and your obesity will disappear. Yes, your obesity will come down. If you are 140 kgs, you will come to 80-90 kgs. But then if you eat the wrong things, if you eat sweets, sugars, ice cream, shakes, your weight can also come back to a little, not as before, but definitely regain. So it's a lifestyle management also.
Does the time of the day I eat affect weight gain?
Yeah, so that's a very important question. I always say that eat during the day. You've seen animals, animals never eat anything at night. They will never attack you unless they're out of fear, they attack you. All animals eat during the day. They get up in the morning, they sleep by 7 o'clock, 8 o'clock, and they don't eat anything at night. We humans tend to eat everything at night. We will work during the day and start eating at 7:38, have drinks, and then keep eating till 11:30, and that's where all the problems start. If you want to avoid obesity, be like an animal. They don't eat and they are not obese, they don't have diabetes, they don't have hypertension, and they never see a doctor.
Is intermittent fasting really effective for weight loss?
Yes, intermittent fasting is a very effective tool for weight loss. The problem is people do intermittent fasting only for a short period of time and then they get fed up and they can't maintain it. So do something which is more logical. So if you're doing intermittent fasting, have a good breakfast, have a good lunch, and skip dinner, and don't eat anything, and until you have a late breakfast again. Keep an intermittent, say 10 to 12 hours of fasting. If you can stretch it to 14 to 16, it's great. But do it every day. You do it for 1 month, 2 months, you lose a couple of kgs, and then you go back to your normal lifestyle. It doesn't work.
Do cheat meals ruin the progress or are they okay?
See, cheat meals are okay if you're doing dieting, exercise, and you have a wedding coming up, you have a birthday. Yes, you can have a good meal. It's not going to ruin your program. I mean, you can always have 1 or 2 cheat meals, but don't make it a habit.
Are there foods that actually boost metabolism?
Yeah, there are certain foods that boost metabolism, but generally, most foods add calories. There are certain foods which have less calories, which are less calorigenic, which is less cause less. More metabolism of a food like nuts. They're a good example of having nuts, fresh vegetables. These are foods which make you feel full but don't make you feel hungry. But if you have just plain rice, curry, and fish, and you will immediately feel hungry because you have not had anything that's very substantially protein based. Rice, curry, and fish is more of a carbohydrate based diet, and that's where we are facing all the problems in Goa.
Dr. Sujoy, any final advice for viewers struggling with obesity?
A good message to all these people who are struggling with obesity is, don't feel ashamed about obesity. It is a scourge of the medical new generation, the present generation. It was not there 25, 30 years back. And there are ways you can overcome it by changing your lifestyle, by changing the foods that you eat, by doing exercise, being active, sleeping well, avoiding all the vices of the modern generation. And if all else fails, we are always there to help you. The doctor is always there to help you.
Such an important message. Thank you for joining us and sharing your expertise on the topic.
Yeah, thank you very much.
And to our viewers, always remember, obesity is a disease, not a failure. Treatment is around the corner and you're not alone. Share this podcast to break the stigma. I'll see you in the next episode. Until then, take care.